Hello, my name's James Wokes. I'm a consultant plastic, reconstructive, aesthetic, and head and neck surgeon based in the north of England. Go back a little bit. I first did a degree in psychology and biology after I finished school, and then after that, I worked in a private hospital for about a year, mainly doing plastics and orthopedic surgery, and that's where I met some really inspirational people who kind of pushed me towards a career in surgery. And then when I was at medical school in Newcastle, again, further inspirational people, lots of experience in plastic surgery, by which time I finished medical school, I was kind of running my own operating lists. The variety of procedures that we do in plastic surgery is immense. I operate from head to toe in people who are newborns all the way up to people who are 100 years old. So the variety is fantastic, which keeps it really interesting. My training in plastic surgery has been pretty extensive. I have been fortunate to be trained by some of the world's best, both in the UK and abroad. So plastic surgery is just one of those things where you make a massive difference to people's lives. You find some patients coming in with really, really complex, life-changing presentations, and the ability to help them and restore their form and function is just so rewarding. Yeah. The patient outcomes, really, as I said, the presentations that we see, whether it be trauma or cancer or aesthetic presentations, they're all such a varied group, and the ability to get people from where they are to where they want to be is just really such a privilege. Aesthetic patients and NHS patients come with different expectations, but ultimately you're trying to achieve their goals, whether it be restoration of function or improvement in form. So yeah, it's the outcomes that patients get and the smile you see on their face when they get the result that they want. I'm very open, I'm very honest. I always act with integrity, but above all, I think my communication skills are up there with the best, if not the best. My patients are regularly complimenting me on the fact that I'm always in touch, always available for them if they've got a question, because going through surgery, whether it be aesthetic surgery, cancer surgery, it can be really quite a daunting time, and you often feel like you're alone and don't have anyone to ask questions to. So being available, being open and honest with them, and giving them the answers in an efficient time frame is really important. I think that's what my patients value most about me. Again, they need to be honest and open with me. If a patient comes and they're not happy, I want them to tell me. I don't want them to be hiding away with disgruntlement and not be able to feel that they can talk to me about it. You need to develop a relationship with a patient. An aesthetic patient has expectations, and you have to understand what those expectations are for you to be able to deliver their care. So a patient who comes with realistic expectations, who is open and good at communicating back with you what they want, is probably the best candidate for any aesthetic surgery procedure. One of the things I regularly say to patients is primum non nocere, which is Latin for first do no harm. We're in a business where there's a lot of people out there offering a lot of things, but I'm not arrogant enough to think that I can do everything. And I often say no to patients when I don't think I'm the right person for them. To do harm to a patient is bad. So first do no harm is definitely a mantra to live by in surgery. Yeah.